brings you in today?
Um, I am trying to get prescribed medication for symptoms, emotional symptoms that I've been dealing with.
Okay. Yeah. So what kind of emotional symptoms have you been having? What's been going on?
A lot of depression, a lot of anxiety, nightmares, inability to focus, a lot of like loss in, um, I guess like social empathy that I used to have. I feel so overcapacitated emotionally that I'm tending to not care about other people and other things like I used to.
Mm, okay. So would you say that about the depression, anxiety are about equal, or is one kind of superseding the other?
Um, they kind of take turns.
I'm sorry, say that again for me.
They take turns being more serious, if you will.
Okay.
Like for instance, right now, the depression is more severe than the anxiety.
I see. How long have you been living with depression?
I've probably been living with it my entire life, to be real with you.
Mm-hmm.
But I've been actively trying to get assistance for the last 7 years, and I've just now been able to get assistance over the last year.
Okay. So would you say this is your first time formally having prescribers and therapy?
No,
No.
I've
Okay.
I've had I've gone through about 4 to 6 therapists um, since I've been like seeing people.
Okay. And then have you tried any medications in the past?
I have tried Caplita.
Okay. How did that one work for you?
Um, Too many side effects that made it impossible to continue.
Yeah. Mhm. Okay. Any other meds you tried, or is it just the Caplyta?
The other one, I don't remember the name of it, but I only had it for about 4 days before I was prescribed Caplita. So
Okay. So kind of too short a period of time to really tell.
exactly.
Okay. All right. Let me see here. So how would you say your sleep is? I know you're saying that having a lot of nightmares recently.
Yeah,
What
my
would you
sleep
say?
is very poor. I get to sleep and then I wake up very shortly after and remain awake.
Okay. So falling asleep's okay, but staying asleep is the problem?
Exactly. And sometimes falling asleep is the problem, but because I'm pretty busy throughout the day regardless, and I'm not sleeping very well at all, typically I can fall asleep. But yeah, I'll say like I'll fall asleep around 10 o'clock and by 2 o'clock I'm awake.
Okay. And then whenever you're having these nightmares, and you don't have to go into detail, but are they usually connected to something you might consider traumatic that happened in your past?
Um, I don't know. Typically they're like either someone's chasing me or like a tidal wave.
I'm sorry, it kind of cut out a couple times there. You said they're facing you?
Chasing.
Chasing. Okay. Right. Would you say that there's anything in your past that you consider traumatic that impacts you today?
Absolutely. Like so many things.
And what kind of ways do they affect your day to day? You know, some people have flashbacks or kind of feel like they're living in fear, like looking over their
Definitely,
shoulder.
I never feel comfortable. I never feel safe. I always feel anxious. If I'm trying to relax, I feel like I'm doing something wrong. Um, I have a lot of triggers that will remind me of past situations, some things that I'm remembering for the first time, and some things that I'm remembering repeatedly that cause me a great deal of emotional distress and like phantom pain, so to speak, like my body remembering the feeling of pain so intensely that I can like feel it almost, you know? And I feel all of the emotions that I guess I should have felt back then, but I'm feeling them now because I'm more aware of certain circumstances and stuff, you know.
I see. Any times where you feel like, you know, some people, when they're struggling with things that have happened to them that are traumatic, they sometimes have kind of outsized responses, like they feel kind of irritable and might, you know, lash out at someone where they don't really mean to. Does that ever happen for you?
I pretty much keep myself away from everybody. So, like, I'll drop my daughter off for daycare and then I'm pretty much by myself unless I go to the store. I have very limited interaction with other human beings. I tend to feel very unsafe around other people. Like, I will, if I'm like interacting with someone, it doesn't take too long before I start envisioning them attacking me. And sometimes I am 100% positive that they are plotting to harm me.
Has that happened in the past for you? Has someone tried to hurt you or?
Yeah, I've been very hurt. I've been very ganged up on, not just at home, but also outcast at school, bullied at school. Um, at jobs I've had like the mean girl situation where girls will like there was a situation at work where these girls like took my pictures off social media and put them on an escort site and like wrote letters to the guy that I was hanging out with and like told him that I was a prostitute and he was gonna get STDs because I had them and just a lot of I've dealt with a lot of bullying and a lot of childhood traumas.
I'm sorry that happened to you.
Thank you.
Okay. Any times were you ever feeling like you were hearing or seeing things other people aren't really hearing or seeing?
Not really. I mean, sometimes I'll get like ringing in my ear. Sometimes I'll get like weird thoughts in my mind that I know for certain I shouldn't. Like it feels like they're outside thoughts, but they're my thoughts. You know what I'm saying?
Yeah, almost in a sense of like they're there and you know that they're originating from you, but you don't
Yeah,
feel
exactly. Like
fine.
it's not like a voice coming outside of my head. It's like the same as my own thoughts, except it's like she's gonna drug you or be careful, someone's, gonna be over there to jump on you if you go, and it's like why? But I get why because I actually have had people like plotting to do harm to me and I have overheard people, but this is a long time ago, and but it's still very much haunting my psyche because I'm like not over it perhaps there's been so many overlapping situations that I can't convince myself ever that I'm safe.
Mhm. Yeah, sounds like living in fear, kind of on the
Yes,
day to day.
constantly. Give me a second, please.
Yeah, sure.
I'm back.
All right. And some people, you're kind of saying you have these thoughts that don't really feel like yours. Sometimes people feel like they have these moments where, they're almost like dissociated, where they feel like things are happening. You're kind of on the outside watching, even though you know that you're the main person where this is happening. Does that make sense? Does that ever happen for you?
I'm sorry, I don't understand the question.
Yeah, kind of just asking about like it's called dissociation. So some people, especially when they've had a history of trauma, when things are happening, it kind of feels like you freeze and you're more like observing what's going on than feeling like you're an active participant.
Yeah, definitely. Or I will like not like, I don't know if it's like blackout, but it's like I'll come to realization that I've been sitting in the room for 10 minutes with people talking and I have no clue what just happened.
Mm-hmm.
And I'll look at the clock and it's like 30 minutes have passed, or the show is going off and it's like I've been sitting in here awake, but I don't recall like what happened in this movie, or like what were you guys talking about. Like
Right.
I've had my siblings like nudge me like Earth 2, you know.
Yeah. Almost kind of like blanking out a little bit and then coming to.
Yeah. Or just being so in my mind, so focused on my thoughts, or so focused on not thinking about anything at all.
Yeah, and that was kind of something you mentioned when we first started is that anxiety is this other big piece, and it sounds like depression, anxiety kind of trade off for you. How would you describe your anxiety?
Um, Pretty intense. I mean, it's like just constantly feeling like I either like I'm in trouble, basically. Constantly feeling like I'm in trouble and I need to figure out how to get myself out of trouble. Like that's the best way that I can describe it. Like I always, and it's like a nerve-wracking constant feeling. Um and then like I'll find myself very often like looking for something. Like I'll just be in the bathroom looking through all the drawers, and then like I don't know what I'm in there looking for. Like I don't remember what I went in there to look for. Or I'll go in the kitchen and do the same thing, or in the living room. It's just it like keeps happening.
Mm-hmm. Yeah, it kind of sounds like there's almost so much on your mind. It's
Yeah,
becoming difficult to kind of do these normal tasks during the day, and it's kind of getting in the way of you doing those things.
exactly.
Mm-hmm. How would you describe your energy?
Very
You
low.
ever feel, yeah. Any panic attacks?
Um, I was having panic attacks, but I don't think that I've had an actual like I used to have such severe panic attacks that I would like shiver in terror for like hours at a time. That hasn't happened to me in a long time. But I still have had like situations where like I'm trying to visit my sister and all of a sudden I feel so unsafe that like I just need to go. Like I need to be at home. And like I can't be around anyone. Or like if I'll try to talk to like a neighbor or something and have them come over, like I'll start feeling like I need them to leave because they're like going to attack me or planning to attack me or want to attack me.
Mhm. Do you consider yourself close to your siblings?
Yeah, I have a lot of siblings. I'll say I'm close to about six of them.
Great. Any friends in the area that you keep up with?
No, I did a pretty good job of getting rid of all of my friends about 4 years ago. I was having such severe anxiety that I couldn't be around anybody. And I kept feeling like everyone wanted to like hold me captive and torture me.
Mm-hmm.
And I've like unfortunately I had to isolate myself from everyone because it was just like I can't even describe the terror that I was feeling on a constant basis. Literally, like I would like shiver all throughout the day, and I wouldn't even tell anybody until like one time my sister was home, and I just like I was going, I kept feeling like I needed to like kill myself before something worse happened to me, and I was
Mm-hmm.
going to like jump out of the window. And so I like told my sister because she was there.
Have you ever tried to take your own life?
No, I was desiring to unalive myself about 10 years ago, and had some family members intervene. And I now have a totally different outlook on life and death, so I don't have the same desires, but very often I still do wish that I just never existed at all.
That's kind of a current feeling you're saying?
Oh,
Kind of that
yeah.
feeling that you wish you weren't existing?
Yes, for sure. Like never existed.
Have you ever had to go to the hospital for any of these feelings?
Um, there are times where I should have gone to the hospital, but I actually have been too terrified to go. The doctor's office is one of the probably the number one place that terrifies me the most.
And just so I understand it, and it's kind of for the same reason you're concerned that they might be doing something to hurt you or
Oh,
have
for
plans
sure.
to hurt you.
For
Yeah.
sure. For sure.
And is it mostly around like poisoning, or are there other ways that you're worried about?
Like torture me. Like experiment on me.
Mm. Do you feel like if your feelings ever changed and you were concerned you were becoming suicidal and might act on those thoughts, do you think you'd be able to go to the hospital, or do you think kind of this fear would keep you from going?
Fear what keeps me from desiring suicide. Like fear holds a lot of power in my life at this moment, unfortunately. And I've gained a pretty healthy fear of death. And so suicide is not something that I consider, or death being the fact that it's an event that has consequences for your loved ones and unforeseen and unpredictable consequences for your soul. And because of that, it's not something that interests me. I'm very much interested in improving my life and my existence and going back to the state of pleasure that I once had. I used to actually, even though it was maybe blissful ignorance, it was still a period in my time where I was able to enjoy life and myself and social events. And my daughter deserves a healthy mother, and so I want to live for her and I want to live to get back to happiness and pleasure.
Yeah. When was the last time you felt that way?
Um, it's been more than 10 years.
Mm. And it has to feel so exhausting living in fear like this. You must be
Yeah,
tired.
yes. I think during the time I was pregnant, I experienced a lot of times where I didn't feel the anxiety as much, but then the closer I got to giving birth, it began to come back.
Mm. Did you ever have any kind of shifts in your mood after delivering?
My birth was very traumatic, and then a lot of family issues began to occur, and
Mm.
so things went pretty downhill. Um, I started being stalked by the father of my child's ex, who had pretty much a team of people after me, harassing me, terrorizing me. Um, it got pretty traumatic, so I didn't have any like break from traumatic events occurring repeatedly.
Mm-hmm. Yeah.
I
Sounds like you
had
never got
to,
that moment to even process one trauma before the next were coming in.
exactly, I had to get the law involved and go through court procedures to get protective orders and anti-stalking orders, but my car was stolen, my place was broken into. Um, I was confronted by um, a gang of her friends
Mm.
when I was holding my child. So things got pretty terrifying.
I can't imagine. Well, we've kind of chatted a little bit about when we're feeling kind of low or anxious. Have there ever been any times where you were on the opposite end of that? And I'm kind of speaking more specifically to like bipolar disorder, and some people might have symptoms of mania or hypomania. Has that ever happened for you?
Like bursts of feeling happy and joy. No, I haven't, unfortunately.
Yeah, well, sometimes it can look differently too. I mean, that's the kind of the textbook euphoria that we see in mania. But sometimes people feel like excessively irritable, just kind of like a huge increase of energy. Um, they go multiple nights without sleeping or racing thoughts and talking really fast.
I have racing thoughts, but the talking really fast and the energy part, no.
Okay. Yeah, it sounds like the racing thoughts they sound a little more connected to anxiety.
Yeah, and like when I wake up, one of the reasons I can't get back to sleep is because I'm thinking about like everything in the universe, basically.
Are there things that worry you, or you just feel like you can't shut your mind off from having any thoughts?
Just can't shut my mind off from having any thoughts. Like I'm trying to hear what's going on in the neighborhood and see if I can get my third eye to open and what that's like.
Gotcha.
Doing some
Okay.
praying, trying to figure out what exactly and who exactly God is.
Yeah. Sounds like you're kind of in a period of spiritual development.
Yes, for sure.
Okay. So it kind of sounds like what you were saying earlier, no history of kind of these mania or hypomania symptoms we talked about. Any family history of bipolar that you're aware of?
I guess my father was diagnosed as bipolar, from what I hear.
Okay. And then any times in the past where you tried a medication and kind of gave you way more energy than you felt comfortable with?
No, the only medication that I've ever tried was Caplita, other than the other one that was 4 days. I don't remember the name. And it definitely did not give me any energy, but it did give me euphoric feelings.
Okay. And how long ago did you try the Caplita?
I haven't been on it for maybe over a year.
And before that, how long were you taking it for?
I think I had it for like 2 months.
Mm-hmm.
Actually, I think I had it for like maybe 4 to 6 months.
Okay. And I'm sorry if you said this already. Did you find that it was helpful for you, or did it change your symptoms much?
No, it was helpful. It just had too many side effects that were like, when you have to take an additional medication to get rid of the side effect. And also, I was trying very hard to not get high. And it was making me high, and then it started to cause me anxieties because I started to feel like I was going to get addicted to it because of the euphoric feelings. And then it was giving me weird side effects like making my hands cold and my feet hot, and then my nose would get stopped up, and then sometimes it would make my heartbeat speed up, and then it would make it where I couldn't sleep, but I was extremely tired. So
Okay. Sounds like you kind of had a lot of reaction to this
yeah,
medication in
yeah,
order to do
yeah. That's why I eventually was just like, it's not even worth it.
Yeah. What you said that they then needed to prescribe something to treat the side effects. Do you remember what that was?
No, I was taking an over-the-counter allergy medicine to get rid of the stopped up nose.
Okay.
Yeah.
Any side effects like abnormal movement, especially of like the face or mouth? Sometimes that can
Um,
be a rare but more serious side effect of drugs like Caplyta.
no, like my fingers, I will wake up with my fingers numb a lot.
Are you taking anything over the counter
I
right now?
was using ibuprofen, but I'm going to cut back on that because it gives ulcers.
Mhm. Any medical medications that you're taking?
Like
Anything for
Benadryl.
Benadryl?
Yeah.
Nothing else.
No.
Any allergies?
Yes, I have seasonal allergies.
All right. Okay. And then how would you say your appetite is?
Um, too much. Like it never goes away. It's like I'm constantly fighting myself to not eat and eat and eat and eat.
Mm.
It's become a very guilty pleasure.
Any concerns with body image that ever impact the way that you eat?
Um, when I could control it, yes, but now at this point, I'm feeling like it's become a problem to the point that I'm trying to I'm like excited about food, but then I'll get like really upset that I ate so much, and then I'll still eat though. But then
Mm-hmm.
I'll like not eat for like 2 days. But then like I'll go back to like I when I can't like I'll have like the break in ability to control myself, that is, and go back to like, because even if I'm trying to not eat, I still have to like, prepare food for my daughter twice a day. And so I can't like, and the thing is like when she's not here, I'll eat too though. But then it's like when I'm like, okay, I'm done eating for the day, then it's time to pick her up and it's time to make her dinner. And I'm gonna eat that too. And then
Mm-hmm.
it's like, if I'm waking up in the middle of the night, it's like, oh, there's ice cream downstairs, or there's cookies and milk, or. So yeah, I'm trying to like combat that right now.
Any history of purging whenever you feel like you've eaten too much or you're feeling uncomfortable?
Um, because I have a pretty good digestive system, no.
All right.
But I guess like I will go on fast. Like
Mm-hmm.
I'll tell myself I'm gonna like not eat anything through the weekend to like compensate for all that I've eaten over the week.
What would you say is the longest time you've gone without eating?
I did spiritual fast before, and I've gone 10 days.
Okay. And then, kind of outside of the spiritual fast, just whenever you're feeling like you need to compensate for what you ate, how long have you
Um,
gone?
about 2 days.
Any use of diuretics?
I don't know what that is.
That's just something it also makes you pee a lot. Helps get fluids out of the body.
No, I don't think so.
Okay. Okay. And then whenever you were on the Caplita, do you remember who prescribed that for you or which
Um,
organization?
yeah, it was a place in DC.
Okay.
I can't remember off the top of my head, but I'll text it when I remember it.
Yeah, it's not a big deal. I was just curious. So did you move to Seattle pretty recently?
Yes. About a year ago, actually.
Okay.
Actually, no. Yeah, actually, yes. March. So about a
Okay.
year ago.
Yeah, you're almost on the 1 year mark.
Hmm.
And you have family in the area?
Yes. Most
Oh,
of most of my family is here. That's why I
okay.
was forced to move back reluctantly.
Oh, at your family's insistence? Is that kind of what you're getting at?
Exactly. And my daughter also, she craved a community and to be around family. So
How are you doing with the weather?
it's pretty much similar. Honestly, I grew up here, so I love the weather. I'm one of the people who loves it.
Oh, good. Good. Okay. Well, that's great to hear.
Yeah.
Opposite, I'm originally from the East Coast, so these winters are tough. And I know, obviously, being in this area, a lot of people have sad, but it sounds like you are no stranger to this weather.
Yeah, no, I love it. The sun in DC was a bit brutal. The summertime there is, boy, it'll get ya.
Mhm. Yeah, no joke.
Yes, it's like don't come outside before 7 p.m.
It's true. Yeah, my partner always asks me, he's like, "How did you live there, like with the heat?" And I was like, "We all just stay inside with the AC,
Exactly, exactly.
only way to get by."
Yep. Become vampires and come out at night. That's what I did.
Exactly right.
It
And
was
even then, it's still hot.
Yeah, and I've even like experienced summertime in Hawaii and DC summer. It was definitely worse.
It's punishing.
No, yes, yes.
It's not good.
No.
Not good. Okay, I've got some medical questions for you, so I'll just kind of read through these, and if anything applies to you, just speak out.
Okay.
Um, any history of traumatic brain injury, seizures, tic or movement disorders, or stroke?
No.
Any issues with swallowing or hearing loss?
With falling?
Oh, I'm sorry, with swallowing.
No.
Any cardiac illness or cardiac problems in the past?
No.
Any respiratory illnesses like asthma or COPD?
Mm-mm.
Um, any nausea, vomiting, diarrhea, constipation?
I have had constipation in my youth.
Okay. Any issues with it now?
No. Now I'm quite regular.
We love to hear it. It's underrated, but being regular is so important.
It really is. It really is.
Any problems with your kidneys or your liver?
No.
What about thyroid or any history of diabetes?
No. Not with me anyway.
And any kind of muscle pain, chronic pain, anything like that?
I am having chronic pains. I have been in a couple of car accidents. I am currently in physical therapy.
Is that what you're taking the ibuprofen for?
That is exactly why, yes.
Any history of major skin rashes?
I do. A long time ago, I got a really bad skin rash that none of the doctors could figure out what it was. And then it went away after I think it was about 2 weeks. But it was quite terrible and very ugly.
So sorry. Any major surgeries in the past?
Only I mean, I don't know if giving birth is a surgery.
It's a major medical operation for sure.
Yeah, it was a natural birth though, no C-section.
Okay. And do you still have your menstrual cycle?
Absolutely. Every damn month.
Do you remember your last period?
It was on the 12th.
And are you currently connected with a primary care doctor?
No, not yet. I have an appointment coming up though to become
Oh,
established.
great. When was the last time you were able to be seen by a primary care
Oh God,
doctor?
it's been a while. I think maybe I had a primary about 4 years ago.
Okay. All right. And then can I ask a little bit about any substance use? I would like to start with caffeine. Any coffee, tea, caffeine pills
No
during the day?
pills, no pills, but drink.
Mhm.
Uh,
How many cups of coffee or tea or whatever your beverage is?
Coffee and tea, probably about at least 2 cups a day. The tea doesn't really have caffeine in it. It's mostly like clove tea,
Okay.
clove and like rosemary, stuff like that. Cinnamon, turmeric.
All right. Any tobacco use?
No.
Any history of use?
Oh yes. About 7 years ago.
And how much were you smoking then?
I really just kind of picked up a habit for about 2 months and then dropped it pretty easily.
Okay. Any alcohol use?
Yes, rarely.
Rarely.
Hmm.
Any history of heavier drinking in the past?
No,
Oh. And no history of like withdrawal symptoms from alcohol, like tremors, seizures?
no,
Okay. Any cannabis use?
no, that's a whole nother story. Yes. For a while, a good 10 years, it was my air.
Mm-hmm. Where would you say you're at? You're at with it now.
10, I'll be 1 year sober completely, April 23rd.
Congratulations.
Thank you. It's an uphill battle, but
Yeah. What made you decide to step away from it?
I had a really bad panic attack or psychotic episode, I guess I would probably call it a psychotic episode that was stemmed from it. It had been making me really paranoid for a while, and then that time it was just an all-time bad. So I was like, I never want to feel like this again. So I just didn't do it.
Yeah. What ended up happening during that time?
Just a lot of terrible things went through my mind, like surrounding my child being tortured. So
Mm-hmm.
yeah, it's really terrible. So
Any history of stimulant use, like methamphetamine or cocaine?
no, never.
And then what about any opiates, like fentanyl, Percocet, heroin?
I have tried Percocets before. They make me projectile vomit.
Oh. Any history of consistent use, or was it you
No.
just tried it a couple times?
Yeah, I tried it a couple times. Like when I say it makes me projectile vomit, I mean I take it and 30 minutes later everything that I ate that year is coming up.
Oh no.
Like it cleans me out completely.
The last thing you want.
Well,
Unexpected.
yeah, it was very unexpected. It makes so
And
there is nothing left inside of me.
oh, And then any history of misuse of benzodiazepines like Xanax or Ativan.
No, I've never had any of those.
All right. Any other psychiatric history in your family that you know of? I think you mentioned your father has been diagnosed with bipolar disorder.
Uh-huh.
Anyone else? Anything else?
Um,
Depression,
yeah,
anxiety.
depression, PTSD, PTSD with psychotic episodes, suicide attempts.
And are these your parents you're referring to, or
No, my
siblings?
siblings, yeah. I won't say which ones, but yeah, multiple of my siblings are dealing with depression, PTSD symptoms.
Great. And then just a couple of background questions. How would you describe your childhood?
Very terrible. I mean, one of my sisters used to slit her wrist literally every week. Our childhood was the most traumatic, very abusive, very secluded, isolated, homelessness, poverty, religious abuse, social abuse, constant drama.
Mm-hmm. Sounds like it was a very painful experience.
It was.
Mm-hmm. What about school?
Um, the first time I went to school, I was 8 years old. I didn't know my ABCs.
How was that afterwards?
I learned pretty quickly. I was reading at a college level by the time I was 12. So,
Okay. And did you finish high school?
no. I was sexually assaulted in high school by three guys, and then the guidance counselor convinced me not to make a big deal out of it. Um, and I ended up dropping out after a lot of bullying occurred due to rumors.
You shouldn't have had to go through that.
No.
Okay. And then last question, any history with the legal system?
No. I mean, yes. I had to file cases against some people who are harassing me.
I remember you mentioning that.
Yes.
Okay. All right. So I think that is kind of everything I wanted to ask, at least for today. And what I'm hearing a lot of is what you said already. It sounds like a lot of depression.
Yeah.
A lot of depression that you've been living with for a very long time, and then this anxiety that kind of also takes the center stage as well.
Yes.
And I'm hearing a lot of trauma, a lot of symptoms of what I see as PTSD. Has anyone ever talked about that with you?
Yeah, my therapist mentioned PTSD as something that I was dealing with for sure.
Yeah. What do you think about that?
I think that it's quite accurate. I have done research on this for like a long time ago. I think that it's kind of like an obvious diagnosis based off of like the blatant description of post-traumatic distress. It didn't take much for me to read into it and say, yeah, this is definitely what I'm dealing with. I didn't know that, because it's a pretty common term, but I didn't know all of how, um, and I guess how like severe it is, you know.
Yeah. And a lot of these symptoms that we have, we think of trauma, we think of kind of these like mainstay features where we're feeling scared or having nightmares. But then there's other ones where we don't really think about it as much. And sometimes those are, you know, we feel like we lose interest in the things that used to interest us, which is really common with depression, but we can see that in PTSD too.
Yeah.
We can see kind of these anxious features or like exaggerated startle response. There's kind of a lot of things where we don't normally think about that when it comes to mind, but it exists, and even trouble concentrating is there too.
I,
So
I think it's interesting that like I've heard of this term, um, but it's like during the worst time that I was dealing with the most trauma, and having like physical reactions from it, like for instance, the shivering and terror and stuff, and all the things going through my mind, like it never occurred to me that there is something wrong with me and that it needs to be addressed. It was always just like normal, like this is like it never occurred to me that this was something that could be changed and that it wasn't normal.
right, it's survival. When you're going through these hard times and you're processing these traumas, you're surviving
Yeah.
what has happened and kind of just getting through it. And then whenever we get the chance, we're able to kind of step away and look at these things and say, I don't have to live my life like this, or there are things that can help me, so I don't have to continue feeling the way that I feel. So
Yeah. And I never even like considered help as an option. Like it took me to have a child and actually like get help. Like me doing getting help for myself was actually getting help for my child. And then it's like, oh, the help is for me because I'm the one who's going through all this. It's just spewing out to making it impossible for me to parent. And so it's like, and now I kind of feel like silly in a way because it's like all of these years that I've gone through sort of suffering so much and not even realizing that it was a condition or that it was something that needed to be addressed and that it could change.
absolutely, yeah. And another thing too is a lot of times when you've lived through all of this, you become really independent.
Yes.
And that's another reason sometimes why it does take a little bit before you're ready to take that step and like kind of have that aha moment where you're like, oh wait, I will go to therapy and I can like think about medications, and so that independence piece kind of prevents us from getting there sometimes
Yeah,
because you're
definitely.
so used to having to take care of yourself.
Exactly. And isolating myself was the way that I protected myself until I couldn't isolate myself anymore because I have to take care of a child who like I can't just keep her sitting in the house because you know, she needs to go to the park, she needs to go to daycare, she needs to be on play dates, and it's like, okay, now I have to be in front of people. I have to go to people's houses. I have to go face this teacher and have a discussion and
Mm.
yeah.
Okay. Well, that kind of leads me to my next point about medication. Is that something you're interested in? Because generally, when I'm thinking about depression, anxiety, and PTSD, I think of SSRI. Um, sertraline is a really common one, and then Lexapro is as well. Those are both generally pretty well tolerated by patients. Some side effects are usually in the first couple of weeks, you might have a little bit of stomach upset, and that's because we have serotonin receptors in our gut that get targeted there first, and then eventually your body regulates, and then that usually goes away. And some people might experience a little bit less like sexual interest when they take SSRIs, or they have headaches, but like I said, generally they're pretty well tolerated, and that's kind of more of a long-term thing. So it'll take about 4 to 6 weeks before you start seeing any major results.
Wow.
And then we just kind of keep going from there. And then something else I was thinking about is if anxiety is something that's really kind of weighing down on you through the day, there's a medication called propranolol. And that one's really helpful, especially for like public speaking or anytime you need to like interact with people and you're feeling anxious about it. That one kind of targets more like physical symptoms of anxiety. So feel like your chest clams up, or your heart races and things like that. Propranolol is kind of helpful for that one. And that one is as needed. So it's not something you have to take every day.
Okay.
It's just something if you know, and it's good to take it if you know that there's something stressful that you need to do later. Take it 30 minutes to an hour before, and then the idea is it helps you feel a little less anxious when you go into it.
Yeah, that sounds great.
Yeah, and then for that one, interestingly, it started out as a blood pressure medication, and then as they did studies on it, they realized it was really crappy controlling blood pressure, but it had this unintended benefit that it brought down a lot of people with social anxiety and performance anxiety. So with that, it can cause, it can lower your heart rate, can sometimes cause a little bit of lower blood pressure. So if you're finding that you're feeling a little bit dizzy or anything like that, always change position slowly. Like if you're sitting to standing, make sure you're kind of doing it slowly, being in tune with your body and how you're feeling, staying hydrated, things like that. And of course, if you're worried about like losing consciousness or falling, of course, just stop taking it.
Okay.
Yeah. So what are your thoughts on? I know I kind of threw a lot of meds at you at once. What are you thinking?
The last one definitely sounds ideal. The first two, I'm wanting to know if they, because you said one of them has some digestive effects. I'm wanting something that isn't going to increase my appetite, because I'm already struggling with overeating.
Mm-hmm. Let me think about that, because all of them do come with a risk for increasing appetite and weight gain. I'm trying to think if there's one that isn't as commonly known. I would say Lexapro. That's kind of, they call it like one of the pure SSRIs because it doesn't really have as many drug interactions, and the side effects are usually pretty minimal for folks.
Okay. And then there is the option of like switching if the side effects are too like severe.
Oh, absolutely. Yeah. any of these medications you try out, if the side effects become unmanageable or intolerable, absolutely we can switch them and kind of go back to the drawing board and find something that works a little bit better for you.
Okay, that sounds good.
Yeah. So you're open to trying Lexapro and then
Yes.
giving it a little time and see how it does for you?
Yes.
Okay, great. So we can do that. Lexapro will start at 10 milligrams. And then the propranolol will start you at 10 also. And then we can always increase that if it's not as effective. But I always like to start people low and then work our way up.
Yes, definitely.
Okay. And then do you have a good pharmacy I can send these to?
Yes. There is what is it?
With sending those over, I can always give you a call.
Exactly.
Make sure I've got the right you need it. And we'll just start there and then maybe say meet back and we can do like 3 weeks just to see how the propranolol is going for you.
Okay.
And then after that, if you're doing okay, we can kind of kick out our meetings a little bit later too.
Okay. And then we're going to be doing two medications.
Mm-hmm.
Okay.
Yeah, I like to think about it as the Lexapro is kind of the long-term one that's working in the background to help with anxiety and depression.
Okay.
And while we're getting there, you have a propranolol that can kind of help with day-to-day anxiety.
Okay. So, which one am I supposed to be taking just circumstantially?
Propranolol.
Okay.
Mm-hmm. And I'll make sure all that's on the bottle as well.
Okay, thank you.
Okay. So 3 weeks from now will be March 13th. Does this kind of 1:30, 2 o'clock time work for you?
Yeah.
Okay. I will put you down for 2.
For March 13th, that's when I'm meeting with you to discuss how the medications have been going.
Mm-hmm.
Okay.
Yeah, it'll kind of just be more of like a little check-in, make sure you're not having, too bad of side effects or anything kind of unexpected. Just make sure you're doing okay with them.
Okay.
And then, of course, if you're having any problems, you can always reach out to your case manager or Tasha, and we can always meet sooner if needed.
Okay.
All right.